Have you ever wondered if there's a safe, real way to make your penis longer? You're not alone. In studies of tens of thousands of men, nearly half said they wanted more length, and many of them were already completely normal in size. That tells us something important. Size isn't just about numbers, it's about how we see ourselves and how we feel in the bedroom. Today, we're going to look at the actual science, not the myths, not the late-night internet ads, on what works, what doesn't, and what you should think about before making any decision. We'll explore simple changes you can make at home, proven medical devices, the truth about surgical options, and even how your mindset and connection with your partner can matter just as much as inches. If we haven't met before, I'm Dr. AI, a urologist who believes that sexual health should be talked about openly and without shame. Think of this as a friendly conversation in my office. No judgment, just clear, honest answers backed by research. So, let's get started by separating the myths from the reality and understanding what's actually possible for your body. When we talk about penis size, the conversation is often shaped more by myths and media than by medical facts. Movies, jokes, and advertising have created a kind of ideal that most men compare themselves to and often come up short in their own minds. But let's start with reality. The most reliable studies we have show that the average erect penis length is between 5.1 and 5.5 inches, with a range that typically runs from 3.5 to 6.5 inches. That means if you fall anywhere in that range, you are within normal limits. Yet, in large surveys, 45 to 55% of men say they wish they were longer. Statistically, that means nearly half of the men who want more length are already in the normal or even above average category. There's also a clinical term you may have heard, micropenis. This isn't just a casual label, it has a precise medical definition. A micropenis is an erect length of 2.95 inches or less when measured correctly. And speaking of measuring, let's clear that up because many people get it wrong. In research, we measure from the pubic bone, pressing gently into the fat pad at the base, all the way to the tip of the penis, either in a fully erect state or using a stretched length method. Measuring from the skin alone or in a cold, uncomfortable environment can make a perfectly normal penis seem shorter than it is. Now, here's where psychology enters the picture. Some men experience what's known as small penis anxiety, which in certain cases is part of a body dysmorphic disorder. This is when your perception of your size causes significant distress, even if you're medically within the normal range. I've seen patients who were convinced they were too small, only to find out they were right at the average. The problem wasn't their anatomy, it was the way they saw themselves. I remember one patient, a man in his early 30s, who avoided dating for years because he was self-conscious about size. When he finally came in for an exam, we found his measurements were exactly average. With counseling and education, he gained the confidence to start dating again, and soon discovered his partners were far more interested in his personality, communication, and ability to connect than in a number on a ruler. Mini lesson: how you feel about your body can influence your relationships and sexual confidence just as much as the physical facts. Before chasing a number, it's worth asking yourself, am I unhappy with my body because of reality or because of unrealistic comparisons? And with that understanding, we can now talk about changes you can make without surgery, without spending a fortune, and sometimes without even leaving your home. Changes that can make a visible difference starting today. One of the most common misconceptions about increasing penis size is that you have to spend a lot of money or take big risks to see any change. The truth is, There are a few simple, free adjustments you can make that can improve the appearance of length and, in some cases, the actual function. No pills, no gadgets, just small shifts in how you take care of your body. First, lose excess weight around the pubic area. When fat builds up just above the base of the penis, it can hide part of the shaft, making it look shorter than it really is. This is especially common as men age or gain weight. By reducing overall body fat, not just targeting that one area, you can reveal more of what's already there. I once worked with a patient who lost 25 pounds over 6 months. He didn't just feel better, he could actually see about an extra ½ inch of his shaft without any other intervention. It wasn't magic, it was simply removing the cover that had built up over time. Second, groom the area. Trimming or shaving pubic hair can make a surprising difference in visual length. When the base of the shaft is clear, the entire outline of the penis becomes more visible. It's the same reason a neat haircut can make your face look sharper. Of course, grooming comes with a safety note. If you have conditions like poorly controlled diabetes, be extra careful to avoid cuts or irritation that can lead to infection. Third, manage your stress. This might not sound connected to size, but anxiety can have a real effect on the smooth muscle in the penis. When you're tense, blood vessels constrict and erections can appear smaller or be harder to maintain. Relaxation techniques, whether it's exercise, meditation, or simply taking time for hobbies, can help you achieve fuller erections. Fuller erections mean the tissues are expanded to their potential, which directly affects visible length. Fourth, protect your blood flow. Regular nighttime and spontaneous erections are nature's way of keeping the tissues healthy. If you notice you're not getting them, it may signal a circulation issue worth checking with your doctor. Poor blood flow over time can lead to scarring inside the erectile tissue, which can actually shorten the penis. Mini lesson. Sometimes the biggest improvements come from removing obstacles rather than adding new things. Fat, hair, tension, and poor blood flow can all hide length you already have. Once you've made these at-home changes, the next step is to explore safe, proven, non-surgical options that can help you go beyond appearances and actually create measurable gains, without the commitment and risk of surgery. Once you've taken advantage of the simple, at-home changes, you may be curious about devices or treatments that go a step further, without jumping straight to surgery. This is where we look at non-surgical methods. Some have solid science behind them, some have very specific use cases, and others, well, let's just say they don't quite live up to the hype. Vacuum erection devices, VEDs. These are clear cylinders that fit over the penis. When you pump out the air, it creates gentle negative pressure, drawing blood into the erectile tissue. This produces an erection and, in theory, could help maintain or improve length. In practice, the strongest evidence for VEDs comes from men recovering from prostate surgery or those preparing for a penile implant. In those cases, using a VED regularly can prevent length loss or make surgery easier. For healthy men, the research doesn't show permanent length gains, though some notice temporary fullness right after use. One of my patients used a VED to help with mild erectile dysfunction and found that, while it didn't add permanent length, it did help him maintain better rigidity, which in turn improved his confidence. Penile traction devices. This is where the research gets more promising. Traction devices gently stretch the penis for a set number of hours per day, encouraging tissue remodeling over time. Early studies used 4 to 6 hours daily for months, resulting in an average gain of 1 to 2 centimeters. Newer devices like RestoreX have shortened the daily wear time to 30 to 60 minutes, still showing about a 1 centimeter increase in certain groups, such as men with diabetes or post-surgery shrinkage. The key is commitment. Traction works slowly, and skipping sessions will limit results. Injectable fillers. Hyaluronic acid fillers are mainly used to increase girth rather than length, but they can improve appearance and self-confidence. Results usually last 18 to 24 months, since the body naturally breaks down the filler. Risks include bruising, swelling, uneven texture, and, if done poorly, serious complications. If you go this route, choose a reputable provider with experience in male enhancement procedures. Mini lesson: non-surgical methods are most effective when matched to the right person and goal. If you want to maintain length after surgery, a VED can be invaluable. If you're looking for small but lasting length gains, traction devices may be your best bet. If girth is your priority, fillers could help. But remember, none of these options will turn average into extraordinary overnight. Now that we've covered the safe, non-invasive side of things, it's time to look at the other end of the spectrum: surgical methods. They can deliver bigger gains, but they also carry bigger risks. Let's see what the science really says about those. Surgery is where the potential for visible change is the greatest, and so are the stakes. These procedures are not quick fixes. They come with significant costs, recovery time, and real risks that can impact both function and appearance. Let's look at the most common surgical approaches, what the data says, and what you should consider before taking this step. Suspensory ligament release. This procedure cuts the ligament that anchors the penis to the pubic bone. By releasing it, more of the internal portion of the shaft hangs outside the body, adding visible length in the flaccid state. The average reported gain is about 1.4 centimeters. That sounds promising until you consider the trade-offs. The penis can become less stable during intercourse, and without consistent stretching afterward, scar tissue can cause the ligament to reattach, sometimes leaving the penis shorter than before. In rare cases, nerve injury can lead to decreased sensation or erectile issues. Many men report dissatisfaction simply because the gain wasn't worth the recovery and risk. Silicone sleeve implants. These are custom-shaped silicone sheaths placed under the skin of the shaft to add both length and girth. One large study reported average increases of about 4.1 centimeters in length and 3.4 centimeters in girth. That's the biggest jump you'll see from any method, but it comes with serious potential complications. Around 5% experienced erosion, where the implant breaks through the skin. 5% needed surgical revision due to cosmetic issues, and infections sometimes required full removal. I've spoken to patients thrilled with their results, but I've also seen others whose complications led to scarring, discomfort, or loss of length. The key point: if a risk is only 5%, it's still 100% if it happens to you. Fat grafting or dermal grafts. In these procedures, fat from your own body or tissue from a donor site is added under the penile skin to increase girth. Results can be modest, 2 to 3 centimeter increase in circumference initially, but some of the material is reabsorbed by the body within a year, reducing the effect. Risks include uneven texture, lumpiness, infection, and rarely changes in sensation. On the plus side, because the material is your own tissue, the risk of allergic reaction is low. Mini lesson: surgery should be the last option, not the first. The men who tend to do best with surgical enhancements are those who have tried all other safe, non-invasive options first, have realistic expectations, and fully understand the potential downsides. Even with the most skilled surgeon, complications can happen. And when they involve this part of your body, they can be life-changing. If you're still considering surgery, The best first step is to talk with a board-certified urologist or reconstructive surgeon. Ask how many of these procedures they've performed, what their complication rates are, and to see before and after photos, including cases where things didn't go as planned. Now, before you decide whether to chase more length, we need to zoom out, because as much as this conversation has been about size, sexual satisfaction isn't just about inches. It's also about connection, confidence, and knowing how to make the most of what you have. Let's talk about that. After all the science, devices, and surgical options we've discussed, it's worth stepping back and asking a bigger question. What really makes for great sex and a fulfilling, intimate life? The honest answer is that size is only one small piece of a much larger puzzle. And for many couples, it's not even the most important one. From a physiological standpoint, most women's primary source of sexual pleasure comes from clitoral stimulation, not deep penetration. The clitoris has more than 8,000 nerve endings, twice as many as the penis, and many of them are concentrated in areas that don't require a long penis to reach. This means that technique, creativity, and communication can often do more for your partner's satisfaction than any extra centimeter. I've had patients who came in convinced their relationship problems were due to size. In one case, a man in his 40s was considering surgery after months of feeling insecure. But when we spoke with his partner in a joint session, it turned out her main frustration wasn't length at all. It was that they rarely explored other forms of touch or foreplay. Once they shifted focus to more varied intimacy, both reported a dramatic improvement in their sex life without a single medical procedure. Connection also plays a huge role. Emotional closeness, trust, and the ability to laugh together can make intimate moments more relaxed and enjoyable. When you're confident and present, your partner feels it, and that can be far more attractive than size alone. Performance too is about more than erections. It's about stamina, responsiveness, and being attentive to your partner's needs. This could mean trying new positions that make the most of your natural anatomy, using toys together, or adjusting your pace based on feedback. In this way, you become an active, engaged lover rather than a passive participant. Mini lesson. True sexual satisfaction is built on 3 pillars: confidence, communication, and creativity. Size may influence confidence for some men, but communication and creativity can often compensate for or completely outweigh any perceived size disadvantage. If you do still want to pursue enhancement, go into it with the understanding that it should complement, not replace, these other elements. And if you choose not to, know that you still have plenty of tools to create fulfilling, memorable experiences for both you and your partner. As we wrap up, remember this: your value as a partner is not measured in inches, but in how you make someone feel, physically, emotionally, and mentally. That's the kind of measurement that really lasts. So, whether you're looking to make physical changes or simply make the most of what you already have, remember, confidence, health, and connection matter just as much as size. If you found today's video helpful, give it a like and share it with someone who might need the facts, not the myths. Subscribe and hit the notification bell so you don't miss my next deep dive on men's health. And now, I'd love to hear from you. What's one question about sexual health you've always wanted answered? Drop it in the comments and let's keep the conversation going.